Hello, my dear viewers. Welcome to AI Medical School. In this video, we will discuss the Dexona tablet, but before starting the video, please subscribe to the channel and press the bell icon. Dexona tablet is a medicine from the class steroids. It is used for the treatment of a wide range of inflammatory conditions, allergies and autoimmune conditions. This tablet is also used for the treatment of a certain form of cancer. Dexona contains the steroid dexamethasone as its active ingredient. It acts by reducing the formation of inflammation-causing substances in the body. Dexamethasone is also used to treat nausea and vomiting produced by cancer chemotherapy. Its indications are: Dexona tablet or dexamethasone is primarily indicated in conditions like adrenocortical insufficiency, anorexia in palliative care, brain tumors, cerebral edema, congenital adrenal hyperplasia, dyspnea in palliative care, headache due to raised intracranial pressure in palliative care, nausea and vomiting, chemotherapy-induced pain due to nerve compression in palliative care, palliative surgery, and raised intracranial pressure, respiratory distress syndrome, shock, suppression of inflammatory and allergic disorders, and can also be given in adjunctive therapy as an alternative drug of choice in asthma, blood disorders, connective tissue diseases, GL diseases, liver diseases, malignancy, ocular diseases, osteoarthritis of superficial joints, osteoarthritis, and renal diseases. Its contraindications are: dexamethasone is contraindicated in conditions like diabetes mellitus, hypertension, psychosis, osteoporosis, gill ulceration, infections, and renal insufficiency. Now its side effects. The severe or irreversible adverse effects of dexamethasone, which give rise to further complications, include glaucoma, peptic ulceration, myopathy, osteoporosis, posterior subcapsular cataract, growth retardation, aseptic bone necrosis, ocular hypertension, subcapsular cataract, pancreatic disturbance, Cushing-like features, edema, retinal detachment, moon face, truncal obesity, negative calcium balance. Dexamethasone produces potentially life-threatening effects, which include collapse, suppression of the hypothalamus pituitary adrenal axis, which are responsible for the discontinuation of dexamethasone therapy. The symptomatic adverse reactions produced by dexamethasone are more or less tolerable, and if they become severe, they can be treated symptomatically. These include nausea, vomiting, insomnia, nervousness, nocturia, increased appetite, obesity, facial rounding, fragility of skin, euphoria, glucose intolerance, adrenal suppression, protein catabolism, and lipid metabolism. Now warnings. Dexamethasone should be used with caution in patients with active tuberculosis, infection of the respiratory tract, or in untreated fungal, bacterial or systemic viral infections. Corticosteroids should only be used systemically with great caution in the presence of congestive heart failure, recent myocardial infarction, hypertension, diabetes mellitus, epilepsy, glaucoma, hypothyroidism, liver failure, osteoporosis, peptic ulceration, or renal impairment. Children may be at increased risk of some adverse effects. Corticosteroid cause growth retardation, and prolonged use is rarely justified. Passive immunization is recommended for non-immune patients who do come in contact with chicken pox or measles. Live vaccine should not be given to patients receiving high-dose systemic corticosteroid therapy, nor for at least 3 months afterwards. Killed vaccine or toxoids may be given, although the response may be attenuated. During prolonged treatment with corticosteroids, patients should be examined regularly. Sodium intake may need to be reduced, and calcium and potassium supplement may be necessary. Patients should carry cards given full details of their corticosteroid therapy. Avoid use during pregnancy. Use nasal steroids with caution until healing has occurred. Dose adjustment required in patient with renal. High-risk groups are: the drug should not be given to pediatrics, pregnant mothers, cardiac, or hypertensive patients, geriatrics, and neonates. If prescribing authority justifies the benefits of the drug against the possible damages, he or she should reevaluate them and consult the reference material and previous studies. I hope you liked the video. Thanks for watching.